You wake up first thing in the morning, the birds are chirping outside, the sun is shining in through your window. It's going to be a glorious day. Cue the ominous music. As you sit up to the edge of the bed and put your feet on the ground, you start to feel a little bit of pain in the bottom of your feet. Then as you go to stand up, the real agony starts as pain shoots through the bottom of your feet. As you take your first steps in the morning, it feels like something's ripping apart in the base of your feet, in your arches. This is plantar fasciitis. Plantar fasciitis is defined by pain in the bottom of the foot in the first steps in the morning or the first steps after you've been sitting for a long time. It affects nearly 2 million Americans every single year. If you've had plantar fasciitis for a year or more, there's a 40% chance you're gonna have it for 10 plus years. The plantar fascia is an expansive connective tissue located on the bottom of the foot, which aids in the stability and function of the foot. You can think about your plantar fascia kind of like a band on the bottom of your foot, running from the base of your heel and then splaying out and going to the base of all of your toes. So I like to use this little resistance band as an analogy. And as your foot flattens and absorbs load, so like when you stand up or walk or run, the plantar fascia will actually flatten out and stretch to take up that load. And it absorbs energy and then puts the energy back into your foot or into your step as you're walking. Now the plantar portion of plantar fasciitis makes perfect sense. It's on the bottom of the foot, or the plantar portion. The fascia part makes sense as well because it is a fascial tissue, but the itis part does not. In fact, researchers took samples of the plantar fascia of 50 people with bone spurs as a result from plantar fasciitis, and what they found was that there was no signs of inflammation or itis within the tissues. What they did find was tissue that was broken down, degenerative, and almost jelly-like. It had become weak. Think of this like those breads that aren't actually made from flour. They tend to fall apart when you try to make a sandwich with them. This is really important. Modern medicine still treats this type of condition as an inflammatory disorder and prescribes treatments like ice, anti-inflammatory medications, and corticosteroid injections. Now, if it's not an inflammatory condition, these treatments simply won't work, and they'll have all these side effects that go along with them that are negative. This sort of misguided thinking is rampant in the medical world. In fact, according to the CDC, a full 30% of people who go to the emergency room and get prescribed antibiotics are getting them for conditions that are viral in nature, meaning the antibiotics will have zero impact on the actual condition or treating it. Other treatments like corticosteroid injections should be reconsidered, as in the long run, they will actually weaken the plantar fascia tissue. There's a fascinating research study that compared corticosteroid injections, hands-on physical therapy, and doing nothing. What they found was that in the short term, the corticosteroid injections worked the best, likely due to the placebo effect from the injections. But over the long run, over the course of a year, the corticosteroid injections worked even less well than doing nothing at all. What worked the best was hands-on physical therapy. So what actually causes plantar fasciitis? There's 4 things that are really clear in the research. Number 1 is extended periods of being on your feet. This adds load to the plantar fascial tissue, and if it's too much too soon, will lead to this degenerative condition. Things such as standing, walking, or running. This is especially true if you've added high volumes of the aforementioned activities in the recent past. Number 2 is limited ankle mobility. So this could be tight calves or actual limitation of the ankle joint itself. This limitation in ankle mobility will put more stress on the plantar fascia. The third is having flat feet or high arches. This means that the foot is either too flat, too much stress on the plantar fascia in one direction, or too high, again, too much stress on the plantar fascia in the opposite direction. You may have been told that having a high arch is a good thing, but it is possible to overly stress your plantar fascia if your arch is too high. And the fourth cause of plantar fasciitis is excess body weight. Again, having more body weight stresses the plantar fascia more, and leads to stress over time. What I typically see in my practice is that plantar fasciitis starts when the intensity, frequency, and volume of plantar fascia loading exceeds that of your capacity, or what your body is able to tolerate. In other words, the amount of standing, walking, or running that you're doing exceeded what your plantar fascia was capable of withstanding. Now, if you're not a runner, a non-active person, and you're dealing with plantar fasciitis, it could be more related to a decrease in your capacity as opposed to an increase in the intensity, frequency, and volume of loading of your tissue. There's two ways to handle this condition. We're gonna talk about how to do that in just a moment here. You can either decrease the plantar fascia load by reducing the intensity, frequency, and volume of plantar fascia loading, which I recommend as you're just getting started and treating this condition, or you can increase your capacity to be able to tolerate more load on your plantar fascia. In this video, I'm gonna lay out the 5 principles of treating plantar fasciitis. Principle number 1 is to modify. Remember I talked about capacity earlier? The intensity, frequency, and volume of plantar fascia loading on the other side? Well, the first thing you need to do is you need to reduce the load on your plantar fascia so that it's actually less than your capacity. Now, if you're somebody that gets plantar fasciitis with standing or with walking, you may want to consider a more motion control type shoe that's going to stabilize your foot a little bit better and maybe decrease the load on the plantar fascia. It can be also helpful to wear shoes around the house or to stand on a mat when you're doing dishes. Now, if you're a runner or somebody that spends a lot of time on your feet, you may need to actually reduce the number of steps that you're taking throughout the day or the number of miles that you're running. And I recommend to my patients that they use pain first thing in the morning as their barometer for how their body is being loaded. So imagine you wake up in the morning and your pain's at a 3 out of 10 with those first steps in the day. You go and you run your 3 miles. The next day you wake up and you're at a 6 out of 10 pain, those first steps. Those 3 miles were probably too much load, too much plantar fascia loading relative to your capacity. And the next day you're gonna wanna do less. So let's say that next day you only run a mile. You wake up the next morning and you're at a 2 out of 10 pain, less than that original 3 out of 10. Great, that's probably a good place for you to start. Then you can slowly start to build up from there. It's also really helpful if you're somebody that has plantar fasciitis who likes to walk a lot, that you track the number of steps using a Fitbit, Garmin, or some other sort of step tracker. Look at the number of steps you walked in the day and then assess your morning pain with those first steps. If the number of steps you're walking leads to more pain the next day, you're gonna wanna reduce until you get to the point where you have less pain each morning. It might be really helpful to take up an activity like strength training, swimming, cycling, or rowing to actually increase your capacity without increasing your plantar fascia load, especially as you're healing. It may also be helpful to wear an orthotic. So an over-the-counter, easy-to-access brand is Superfeet. And then if you want to get a little bit more advanced, Barefoot Science makes a really cool orthotic with inserts that progressively move towards more of a barefoot shoe. Principle number 2 is to manage chronic inflammation. Now, this may come as somewhat of a surprise because we said that plantar fasciitis is not an inflammatory condition per se, but chronic systemic inflammation plagues our society and makes us much more susceptible to degenerative conditions like plantar fasciitis. Now, there are many things that contribute to chronic systemic inflammation: an abundance of stress, toxins in our environment, a lack of sleep, the additives in our food, the list goes on and on. In my opinion, there's 3 foods that contribute the most to chronic systemic inflammation. We call them the unholy trinity of food, and they are processed carbohydrates, refined sugars, and industrial seed oils. Processed carbohydrates, regardless of their glycemic index, will spike blood sugar within the body. Obviously, refined sugars are also going to spike blood sugar within the body. When blood sugar spikes, it produces a rise in insulin, which is the fat storage hormone, which promotes inflammation within the tissues. High levels of blood sugar within the tissues also promote the formation of what are called AGEs, advanced glycation end products. These AGEs literally make blood vessels and other tissues within our body sticky. And this sort of gumming up leads to the production of free radicals, inflammation, and widespread problems throughout the tissues. Industrial seed oils are very high in omega-6 fatty acids. If you know anything about the omega-3, omega-6 balance, you know that omega-3s are like the brakes for our immune system and omega-6s are like the gas pedal. Now, if you're gonna drive a car anywhere, you need both the brakes and the gas pedal. So you wanna get where you're going and then you wanna stop. Most American diets are very high in omega-6 fatty acids because of our abundance of grains and seed oils that we eat. This means that our immune systems and our inflammatory responses are running on high alert all the time. If we want to take back control of our bodies and our inflammatory response, we need a diet that's low in omega-6s and high in omega-3s. Principle number 3, don't take a step in the morning without doing this. While you sleep at night, your plantar fascia will be healing. When you step first thing in the morning and put your full body weight on that newly healed tissue, it tends to cause tearing and you restart that degenerative process again. But researchers had subjects do this stretch that I'm about to show you for 30 seconds 3 times before they got out of bed in the morning. And they found that it reduced their plantar fascia symptoms considerably. The reason this works so well is because it warms up and gently stretches the newly healed plantar fascia tissue, preparing it for the full weight of your body. So to do this stretch, you're gonna sit at the edge of your bed, and first you're gonna dorsiflex your ankle or bring your toes up towards your knee. Then you're gonna grab your big toe with your hand and you're gonna pull up towards your knee. This puts a nice stretch across the plantar fascia. Hold this for 30 seconds, relax, and then repeat 2 more times. Principle number 4 is to improve ankle and foot mobility and strength. We talked about earlier how a lack of ankle or calf mobility can actually increase the stress on the plantar fascia. Researchers split plantar fasciitis sufferers into 2 groups, a stretch group and a strengthening group, using the exact exercises that I'm about to show you. What they found was that both groups improved significantly, but the strength group had an even greater reduction in pain. Now, I recommend to my patients using both stretching and strengthening to have maximal effectiveness for reducing plantar fasciitis. Improving ankle dorsiflexion or mobility is relatively simple. One of my favorite stretches to give patients that's from the research is the banded ankle dorsiflexion stretch. I'll have patients do this with their knee bent to get the ankle joint, as well as with their knee straight to get the calf. The best strength exercise to use is a single leg calf raise. Ideally, this is done with the foot elevated from the toes so that the heel can actually drop down below the level of the toes, getting a maximal stretch across the ankle and the calf. Principle number 5 is to move away from cast shoes and get barefoot. So you can see here the continuum of plantar fascia stability with shoe wear. Now, when you're first starting out dealing and managing with plantar fasciitis, you want to make sure that you use a very supportive shoe to help decrease plantar fascia load. But it's really important that over time, you slowly move towards a shoe that's actually going to load your plantar fascia more so that you become stronger and more resilient. If you've ever broken a bone or had surgery before, you know that when you took the cast off of that part of your body, the muscles had withered and atrophied. So it's very similar to what happens when we wear supportive, constricting shoes. The muscles in our feet will actually wither and atrophy to the point where they can't support our foot. But there's good news. Researchers compared 6 weeks of wearing barefoot shoes to 6 weeks of very specific foot exercises, and they found that wearing barefoot shoes worked just as well as specific foot exercises for increasing the intrinsic or the small muscles of the feet. Now, before you go and wear barefoot shoes all day long, I recommend that people start very slow. Get yourself a pair of barefoot shoes and wear them during your daily workout or for a few minutes around the house, and slowly ease your way in so you give your feet enough time to build up the strength without overloading your plantar fascia. Bonus tip for you, walking barefoot in the grass is an incredibly effective way to ease plantar fasciitis symptoms. Researchers enrolled 20 subjects in a 12-week barefoot grass walking program, and they found significant reductions in plantar fasciitis symptoms at 6 and 12 weeks. Adhere to these principles and listen to your body. Your body is incredibly capable of healing, of building strength and capacity if you put it in the right environment. Healing plantar fasciitis takes time. It's really important that you're patient with yourself and with your body, and that you give this plan 6 to 8 weeks to work.